Alright, welcome back to Domains and Dimensions and Applied Behavior Analysis in Early Childhood. This is video part 2. We're beginning with objective number 5. List and identify some characteristics of applied behavior analysis or ABA research. And then 6, identify the relationship between EAB and ABA research. Well, so it's been suggested that the birthplace of ABA research was the University of Washington's Institute of Child Development when Sidney Bijou became its director in 1946. But others have said that the 1959 publication, The Psychiatric Nurse as Behavioral Engineer by Ayon and Michael, was the birth of the field. Either way, the primary goal of ABA research is the development and validation of behavioral technology based on fundamental principles of behavior that can be applied to improve socially significant behavior. So emphasis on socially significant behavior. Now that's a significant contrast from EAB, right? And now we're talking about technology, and sometimes referred to as applied behavioral technology. So what are we talking about here? We're talking about behavior change procedures and assessments. So we're talking about the use of shaping procedures to differentially reinforce perhaps a more socially acceptable topography of behavior or of communication. We're talking about the use of differential reinforcement, something called stimulus control transfer procedures, to teach the verbal operants to individuals with deficient verbal repertoires or weak verbal repertoires. We're talking about using differential reinforcement of alternative behavior, differential reinforcement of low rates of behavior, differential reinforcement of incompatible behavior, differential reinforcement of responsive omission. These are all different. These are all variations of differential reinforcement used to change behavior or improve behavior or teach new skills. For example, the use of prompting, prompt fading, the use of chaining procedures, the use of task analyses to break down complex behaviors or behavior chains into their component parts, so you can target them one at a time. The use of discrete trial training, pivotal response training, incidental teaching. So all of these procedures that I listed are examples of applied behavioral technology that are tied to, based on fundamental principles of behavior discovered in EAB, but which are used in homes, in schools, in community settings to improve socially significant behavior in individuals across the lifespan. So ABA research is not autism research. All right, and sometimes there's some confusion about that. That ABA is like autism therapy. It's not. Okay, so ABA consists of applied behavioral technology, right? So if it's being used in a given setting for a given population, that's great, but that doesn't mean that that's what the technology, or the science is. Much of ABA research is focused on the assessment and treatment of autism because it works. Because it's highly effective with individuals with autism, other developmental disabilities, individuals with intellectual disabilities, and for other individuals with other disabilities such as Down syndrome. But parents and caregivers and educators have been extremely effective at raising awareness of autism and advocating for children and older individuals with autism spectrum disorder and lobbying for insurance companies to cover ABA services and working to get aspects of ABA into law and so forth. And so because all of that stuff all together has resulted, along with many other factors too, in a very heavy focus in ABA research on autism. But as I kind of touched on briefly in the very first unit of this course, ABA research applies to or is conducted across many different aspects of life, across many different age groups. So the flagship journal is the Journal of Applied Behavior Analysis, and I mentioned for EAB it was the Journal of the Experimental Analysis of Behavior, or JAB. And so the primary journal or flagship journal in ABA research is the Journal of Applied Behavior Analysis. And there are many other journals such as Behavior Modification or Behavioral Interventions, or the journals published by the Association for Behavior Analysis International, ABAI. So there are many journals out there that publish ABA research. This is the primary journal in the field. So ABA research can be conducted anywhere organisms engage in behavior. It can be at school, in the lunchroom, in the parking lot, at an intersection, in a hospital, in a prison, a dentist's office, your own home, you name it. ABA research can be conducted anywhere organisms engage in behavior. Now, ABA and EAB have this reciprocal relationship. They inform each other. So each identifies questions for the other to investigate further, with the ultimate goal of advancing a more complete science of behavior. So these are our two major domains we talked about so far, EAB and ABA research. Now, there are characteristics of ABA research and practice, which include A, the use of single subject experimental design methodology. That's where, we've talked a bit about that throughout the course, but I'll elaborate a little bit more. It involves, it can be kind of a little misleading here where it says single subject, because sometimes there's, using single subject experimental design methodology, you'll have multiple participants. So it's not uncommon to have 2, 3, 4 participants in the same study. But in general, the logic works like this, where you have single subject design, you have, let's say, a single participant, and you select a behavior of interest or an aspect of behavior of interest, and that's what you're going to measure. That's your dependent variable. And then you select your independent variable, so some aspect of the environment that you're going to systematically manipulate. And you hold all other extraneous variables in the environment constant to the extent that that's possible. And so then you repeatedly measure the dependent variable over time as you systematically manipulate the independent variable. And so in this way, the participant serves as serves as their own control, in the sense that they are exposed to a baseline condition and then every level of the treatment condition or the test condition. And so as you're repeatedly measuring the dependent variable and systematically introducing and withdrawing the independent variable, you're examining levels of the dependent variable in the presence and absence of the independent variable. And then by doing so, you're able to infer a functional relation, if there is one, between behavior and environment. And so that's all done within a single individual, right? And it should make sense when you think about behavior as something in a single an individual living organism does. Groups don't engage in behavior, so you can't use group design methodology with inferential statistics to study behavior. And functional relations between behavior and environment. You have to study an individual organism. Okay, so typically ABA research involves the use of human participants, but not always. I mean, you could conduct ABA research on, for example, animals that would be, animals that would, have it do tricks and so forth at like a zoo or an amusement park. Okay, so sometimes ABA research is conducted on animals. Early in the course, we gave we looked at a video of rats that had been trained to detect tuberculosis, or rats that had been trained to detect landmines. Okay, so those are also examples of ABA research which are socially significant in the fact that they have relevance to real-world human problems, but they are not involving human participants, right? Okay, so direct observation of behavior and environment. Then systematic manipulation of environmental events, antecedents or consequences. And repeated measurement of dimensional or dimensionless quantities of behavior. So I want to give you an example of ABA research, and I have the characteristics on the side here, so I'm just going to relate these characteristics to these graph data. So these are data I collected in a clinical treatment evaluation to help a little girl with autism and food selectivity to reduce a topography of disordered feeding called packing and increase chewing and swallowing, a target food that her parents felt it was important for her to eat. For example, she had a lack of protein in her diet, and so her family wanted her to eat foods that have protein, and which also that the family commonly eats, so that she would be a regular part of her diet. And so we began targeting ground turkey. So ground turkey was the target food here. We used single subject experimental design methodology, in which the participant served as her own control. She was exposed to baseline and treatment. In this particular very, very complex graph here, this is not a simple graph. This is not a simple treatment evaluation. We have two dependent variables here. Okay, so we have the percentage of trials with mouth clean on the y-axis, on the top panel. On the bottom panel, y-axis, we have the percentage of trials with either mealtime challenging behavior, so that's behavior that's disruptive that would otherwise prevent the onset, pace, or completion of the meal, and then packing, which consists of holding food in the cheek without chewing or swallowing for 30 seconds. Okay, so the way we determined if she had a mouth clean was that we would give her a bite of the ground turkey, and once it went into her mouth, then we would wait 30 seconds, and after 30 seconds we would check and say ah, and then if she showed that there was no food remaining in the mouth larger than the size of a pea, then that counts as mouth clean. Okay, and so this treatment evaluation was conducted in her home, in the kitchen. Mom and Dad were home and doing their thing around the house while sessions were conducted. Right? We have sessions on the x-axis here. Each session consisted of multiple trials or multiple bites of ground turkey, right? And so, and then there was systematic manipulation of environmental events. So what was manipulated? Well, I'm not going to get into too much detail other than to tell you there were 3 general stages of this study. First, I conducted a texture evaluation to examine the effects of the texture of the turkey on the percentage of trials with mouth clean. And then I conducted a packing treatment analysis in which I compared multiple treatment components that had been described in the scientific literature as effective for treating, or let's say reducing packing, but which had not been compared in a single study before. So something called non-removal of spoon plus chaser, which is just a little cup of water that she would drink after the bite. Non-removal of spoon plus redistribution. Redistribution involves using a feeding tool to distribute the food around the mouth in a way that is conducive to chewing and swallowing. And then NRS plus puree only. This is, in this condition here, there was no chaser, no redistribution, but the food, the ground turkey, was blended into a puree. So there's a change in texture there, which was present in these other conditions, but did not involve anything else. It's just a puree. So this was puree plus redistribution. This is puree plus chaser. And then there was a table texture condition where the ground turkey was just presented on a spoon. She was asked to take a bite, and there was no NRS procedure or any of this other stuff here. And so you can see that, in general, there are higher levels of mouth clean in these other conditions relative to table texture. And as we continued to run sessions, we observed mouth clean in 100% of trials for several consecutive sessions. All right. Suggesting that one or more of these different treatment components reduced packing, increased mouth clean. And so, of course, there's repeated measurement of dimensional or dimensionless quantities of behavior. Right? So in this case, it's a dimensionless quantity. I counted the number of mouth cleans in a session, and then divided that by the number of trials within the session, and then converted that to a percentage. So notice that percentage of trials with mouth clean is not a dimensional quantity. Dimensional quantities are rate, latency, IRT, duration, for example. Right? And so down here, I was measuring a different dependent variables, measuring packing down here, mealtime challenging behavior here with the open circle. Again, percentage of trials, so this is a dimensionless quantity of behavior. Okay, so what was learned from this? Well, we learned at about this stage here of the packing treatment analysis that if we use this NRS procedure with a chaser, that the participant showed no packing at all and would just accept the bite, chew it, and swallow it. Wonderful. And we tested whether the intervention would work across some novel foods. So we did pork and beef, and it generalized well to those foods. And then we tried to do a texture fading where we tried to increase the texture from the puree to a little bit kind of chunky. And that didn't work out so well. As you can see, mouth cleans did not stay at 100% like it did with the NRS plus chaser. Well, and then in the next phase of this study, we focused on evaluating the effects of differential reinforcement, instructions, and the NRS and the chaser to see if we can increase chewing and swallowing, specifically when we increase the texture of the food from the puree to something more chunky. And as you can see, in general, the participant chewed and swallowed and demonstrated mouth clean for 80 to 100% of trials with that intervention. So we use single subject experimental design methodology in a young child with autism and food selectivity. In the treatment evaluation, the purpose of this was to help her meet her goal of accepting a few more foods that were important to her family and important for involving her in everyday, mealtime situations with the family. And it involved direct observation of behavior and environment, systematic manipulation of all these environmental events here, repeated measurement of a dimensionless quantity of behavior, right? And so by using ABA research methods, behavior change procedures and assessments validated by ABA researchers, I was able to conduct this study to further evaluate the effects of those procedures and assessments on reducing packing and improving chewing and swallowing in a girl with autism. Okay. So ASR number 4 is the development and validation of behavioral technology based on fundamental principles of behavior that can be applied to improve socially significant behaviors. The primary goal of A, EAB, B, ABA research, C, behaviorism, or D, conceptual analysis of behavior. A few more seconds. Alright, I'll go ahead and close the poll. And the answer here is B, ABA research. ASR 5, the major journal for ABA research is A, JAB, B, JABA, C, JAFA, or D, JEBA. A couple more seconds. Alright, I'll close the poll. Answer here is B, Java. In the ABA research, behaviors are selected for study based on their A, convenience, B, being readily available, C, analytic, or D, importance to the research participants, society, or both. A couple more seconds. Alright, I'll close the poll. The answer here is D. The primary research methodology of ABA research is A, descriptive analysis, B, group design and inferential statistics, C, single subject experimental design, or D, none of the above. A couple more seconds. Alright, I'll close the poll. The answer here is C, single subject experimental design. All of the following are characteristics of ABA research and practice, except A, direct observation of behavior, B, direct observation of environment, C, repeated measurement of behavior, or D, systematic manipulation of behavior. A couple more seconds. Alright, I'll close the poll. And the answer here is D, systematic manipulation of behavior. That's not a characteristic of ABA research or practice. We systematically manipulate the environment, and by doing so, we predict and control behavior, but we don't systematically manipulate behavior. Alright, that wraps up this video part. See you in video part 3, beginning with objective 7.